defining and applying a digital construction strategy. So if Steve, Tom and Harry could join us at the front. I've asked these three guys to join us just to share some of their experiences around the application of digital strategies, their experience in dealing with customers and how they've overcome those challenges. Let's start with you, Tom. In your experience, do organisations you deal with typically have a digital construction strategy in place? How do you go about helping them if they don't? And can you give me a bit of background into that piece?
Sure. So, of course, those organizations typically do. What we find particularly interesting is the most successful ones. So, a lot of organizations will have a digital strategy that will be a centralized function, but the most successful ones we've seen are the ones who enable innovation at the grassroots level. So, it's not just central. You don't have to go through and get approvals for every single experiment, and they basically enable innovative mindset. So people are enabled and have budgets for small experiments at a project level, not at central level. You don't have to go from layers and layers to get things started. And that way, you get much more input into what the strategy could be, what is out there, what could work. So that would be the first thing that comes to mind. The second thing is, obviously, with that approach, it's also about knowledge sharing. So again, the most successful ones we've seen optimized for knowledge sharing. There's internal business cases, there's internal newsletters, there's forums, etc., which make sure again that the information is spread as widely as possible. And lastly, obviously nobody's buying technology for technology's sake. It's about the business benefit. So it's about being able to articulate what that is and having the discipline to go through to define what success would look like for each one of them. What are the KPIs, and actually having the discipline to go through and measure the desired benefit.
Harry, you work for a number of technology organisations now. What are the most common challenges you come across when you're trying to assist organisations in implementing a digital strategy?
I think what I've seen the most is, and particularly in the healthcare sector, is responses to funding applications or funding that becomes available. It becomes about what's going to sell your project to get and secure the funding that you want. So it's not about, and there's a few particular examples, but no one in the room, but a few particular examples we saw last year there was a set of documents or processes that trusts were responding to, and they're up against other trusts to secure part of this national funding for their project, and they're basing their responses on what they think will help them get there, rather than what we were seeing in your presentation earlier, that it's about what the outcome is, and as Rich said, the improving the NHS estate and the patient experience doesn't become the priority. It becomes about, where do we need to be in order to make it work for us, and it becomes about the wrong priorities. That's kind of what I saw.
Steve, defining and applying a digital construction strategy, kind of what you do. Do you want to give us a few sort of tips, tricks, where you start when you're engaging with organisations?
Yeah, I mean, a digital construction strategy is huge. There's that much technology out there, you can just get lost in it. You can invest in the wrong technology because it looks good. You've got to define exactly what you need. You're trying to get technology to bring solutions in. Is it visually so you can see what's going to be built before it's built? Is it about capturing the information around the assets so you can maintain the hospital better once it's handed over to you? There's lots to consider, but don't just buy technology. It's got to be within a strategy. Because you'll buy and invest in technology, and the technology can either go soon out of date and there's better things on the market. What you've got is a strategy. Technology backs up your strategy. Yeah. Once your strategy is defined and the problems you're trying to solve are defined, then we can plug technology to solve those. That's the way we've always gone about it. We can't just go in and sell technology. it just doesn't work. We've got to have a strategy in place. We've got to define what we're trying to do together, and that's why we work with many trusts to do this, and ensure that it's information and the project itself is delivered consistently. Because it's no good having one building or a refurb of a building delivered one way and then the next job comes along and it's done completely different. You've got to get people within the estates department of these trusts really engaged. You know, and once you've got simplified technology in place, people will start to engage in it. I mean, looking at the keynote presentation we've just had, if we can design hospitals better but give visibility to everybody who needs to have visibility of that, and it may not be just people in the trust, it may be a bigger, as you say, community that needs to see it. You know, free viewers, free technologies out there to engage and view this proposed hospital, proposed refurb of maybe a building that's going on, etc. But we can open that up. You'll see when you use the headsets that we've given you in the blue boxes, if you scan that QR code and look there, you can see how, so I disappeared my voice then. You can see how the hospital that's shown on there, how they've used digital visions and images of that to show you how your visit to that hospital is going to be, from entering that entrance door, through reception, right the way through that hospital. And that's an easy way of reusing that data that's going to be generated. And that's why your digital construction strategy is so huge and important, because, you know, you'll see in a minute when we do the case study on Milton Keynes, they were doing BIM. Yeah, we've all heard the word BIM. They were doing BIM on the project, great, but didn't have the strategy defined. So yes, we had great models, but we couldn't do much with them. We just had a nice, pretty picture. And that's because we didn't have that strategy in place. So that's why it's key to get it defined and work within it's not just the estate department, it's maintenance department, it's many factors within that hospital that it's got to be pulled together, define what you're going to do in a project, and make sure and audit that that's what you're going to be delivered at the end. That's your key bit to a strategy really. Sorry, I've waffled on a bit there.
I guess one of my questions is around technology versus process. How much is this about the NHS adopting technology, and how much is it about them changing the way they mention it a lot, changing the way they look at things, changing the way they go about working in order to collect data? You know, is it really hugely reliant on the technology, or is it reliant on mindset and process change?
I'll start. For me, it's a bit of both. Yeah, you've got to look at what you're going to do with all this information we can capture. Yeah, that's the key bit. It is a change, because when a project's handed over, traditionally now we'll probably send a maintenance team out. They'll go and survey the whole ward, building, capture all the assets, put them all into an FM system, the maintenance. Now what we can do is do it all during construction. So it's a complete process change, but hopefully for the better, to be more efficient, and it's technology is just underpinning that really.
Yeah, I think we saw that phase, what was it, 8-9 years ago now, where BIM became a thing suddenly. And I had so many calls of, you know, how much does BIM cost? And actually that's the process change first. And then suddenly all of these technology partners and, you know, startups started popping up, and they're on the phone saying, you need this will make you BIM compliant. And then you've got the government, you know, centralised documents that are saying use modern methods of construction and BIM and 3D and all of these different buzzwords that come through. And it's like, where do we start? How do we pick it apart? We'll buy this, you know, spend 50 grand on that, and it doesn't quite get us to where we need to be, so then we put a bit of cash in there. And that's where I think this strategy piece has really come in, over, you know, from what I've seen over the last 18 months, is then it helps you, as Steve says, you get your plan, you have the process piece, and then you look at what's bringing you value rather than what's addressing buzzwords that might not be relevant in 6-12 months' time.
And how often do you guys think we should be re-evaluating that strategy? How often should it be revisited? Is it a continuous evolution, or is it something that...
It can be, but if it's working and we've got it defined correctly, it shouldn't need to be, you know, that often. Because if we're delivering a building may take 2 years to be constructed. Your strategy probably won't change during that period. It's really just looking at if something's not working and it's not giving you the values that you thought the digital strategy would, I would then look at reviewing it. But it will evolve because everyone learns, technology changes, the way we do things change. But I think it's just start somewhere. We need to get a line in the sand and say, look, this is what we want out of our digital strategy, put that in place, and then evolve from there. So you probably don't need to, but you will need to keep reviewing it for gaps and things that will evolve as you deliver the project.
If great new technology solutions come along from Oculo, Unity and Autodesk, for example.
Who knows?
Yep.
Okay, is anyone in the midst of shaping a digital construction strategy at the moment? Is it something, questions you guys might want to ask to the panel, or is it something you want to catch up with them after, I guess? Was that turbulent sort of on that?
Just taking it all in because it's what's going on at the moment. It's just trying to get that technology. I mean, I'm more interested in, because I work between estates and capital maintenance and capital departments. So I'm looking at the information for the asset management, life cycle costing, life cycle. So, but everything you've said so far, all that's been said, is where we're starting almost from afresh. And then we're looking at it because we're 2D estate information. We're looking to go over to 3D.
Yeah.
So
And it's just when you convert that really, because a lot of your estate will be in 2D from probably blueprints from the 60s or whatever it may be, and it's, you know, do you go out and invest in laser scanning and all that? Probably not. You know, my suggestion is always try and digitise as you evolve the change of the hospital. So as you refurb a ward or anything, that's your opportunity to move it into digital at that point, rather than just trying to do the whole estate, because you're maintaining it as it is now. Why invest a huge amount of money just to digitise it? Do it as you evolve and refurb or rebuild the buildings. Then you've got your strategy in place to capture it correctly then.
yeah, okay.
Has anyone else got any questions of the panel? Oh, yes?
Sorry, can I just make a comment really? Because, I mean, Steve, what you're saying completely resonates as sense. Of course, what we're all forgetting in talking about this is the biggest bit of technology is the human brain. So you, as you walk around, are already absorbing, and then you're trying to use some computer program really simplistically to recreate. And it strikes me as it's a little bit like trying to recreate your home in Lego. The computer program only is yes or no at the end of the day for different little bits and puts the picture together. But that co-production that you're stressing, and I think that's a word that we don't use enough, that co-production and that strategy has to be built with the whole community that this is going to serve. And the mistake that we keep on making is consulting with the senior people in the team, in the place where we're working, and they usually have the least imagination, they're the most set in their ways, and they have all kinds of subconscious biases because they don't want things to change because they're quite comfortable as they are. So they're not going to be the change agents. And the very people who really know how things could change are often lower down in the hierarchy. They've got a much better idea. And of course, they're the people who use the service. And that's the whole of your community. That's why I put up the picture of the whole city. If you're going to have a hospital, it is there to serve a whole community. And you've got to pull all of those people in to tell you what to do. If you go to the people at the top, you'll only get more of the same.
Yeah,
but don't forget the human brain. Thank you.
I mean, that's a good point. No, even like your maintenance within that hospital, the best people to find out is the people who maintain it. Exactly. You know, if they'll tell you what they need, how they need it, what they've got to use that data for, then you work backwards from there.
Porters know a lot.
We're starting on this journey. I think the first thing I do is take the word construction out and put estates in. What I'd really like to know is what the art of the possible is. So you don't have to answer this question now, you can email me the answer. But what is the art of the possible? What's the end product that's out there? How far can we go? Because if you ask, I'm afraid, if you ask the odd estates person, and I'm not taking the Baroness's stance here, but if you ask the incumbent estates team, they won't have a clue because they don't do it, because they're fighting fires, trying to keep together what's already there. So what we need to understand, what I need to understand is what could it look like in the future?
Yeah, hopefully we'll showcase some of that in the coming presentations, but if you've still got the question at the end of the day, me and Steve will be around to field that for you.